get out of the way.
Sounds
Thank you,
good.
Stu.
Good morning, one and all. I am pleased to be introducing Deborah Bickel today. Deborah has lived in San Miguel for 9 years. She has a background in international health and public health, and in tandem with Dr. Ramirez, whom she'll be introducing, they founded Be Well San Miguel to assist expats living here to navigate healthcare challenges and emergencies in Mexico. Please join me in welcoming Deborah Bickel.
Give me some advice. I mean, give me feedback if you can't hear me. My voice is low. Is it good enough now? Not, not. Get the mic low working. And do I have a clicker for the slides up here, Diego? Yeah, I see it. Okay. Thank you. Thank you for having me. I was really delighted to present to Rotary. Um, I've only done it once before. It was right at the beginning of the COVID epidemic. Very different times. And it's nice, once again, to not be worrying about that. Still? Okay, how's that? All righty. Okay. I am going to give an introduction of my colleagues, Dr. Emilio Ramirez and Laura Mirandes, but I'll do it a little later in this presentation when they're doing their parts of the presentation. But I wanted to start this presentation with just telling you just a story that somewhat describes what the work of a patient advocate is. But it's an important story in that it reflects the old way we used to do our patient advocacy, which I have to say was a bit hit and miss. Someone would call me or call one of my partners or coworkers and say they needed X, Y, and Z. We'd go in and do X, Y, and Z, and then disappear. And it was, as you'll see with this story, it's not an ideal situation. And we've switched over to membership format, which provides much more of a safety net around our clients and members. But this is a story from maybe, I've been doing this work now for 9 years, so I think it was maybe 4 years ago, 5 years ago when this happened. But I had a lovely client who had been hiking in Nepal or Thailand and fell and broke her shoulder. She's around 60 years old, 59, 60 years old. And she was medevaced out with SkyMed. And she was not in great shape when she returned. And she asked for nursing care and did not get an evaluation. With what I know now, I would have urged her to get another orthopedic evaluation. But I was managing her nursing care. Her shoulder was managing, I mean, it's oversight. I'm not a nurse, so I'm a physician assistant, and I never worked as a nurse. But I know quite a bit about home-based care because I've done a lot of training of home-based care workers. At any rate, she was doing pretty well. And I didn't hear any more from her. Everybody what seemed happy with things. She was such a delightful woman. She was funny and wicked sense of humor and spoke great Spanish, and her care team really, really liked her. But we all retreated. She said, "No, I'm fine. I'm much better. I can get around on my own." And then I got a call from a frantic, by that time fairly frantic neighbor saying she hadn't seen her at all, had been calling, couldn't reach her on the phone. And I went over with another colleague. Chris Cagle was working with me back then. He's a lot bigger and stronger than I am. And we broke down her door and found her in a coma. And as it turned out, it was a hepatic coma, meaning she had cirrhosis of the liver. What I did not find out, because I probably did not ask, was that she was an alcoholic and a heavy, heavy drinker. And so the combination of a reemergence of a resistant bacteria in her shoulder site around the hardware and her drinking conspired to kill her, basically. We probably could have saved her. I don't know how bad her cirrhosis was. There was no postmortem or anything of that sort. But we probably could have saved her if there had been one more person saying on her watch. And that's what we are now. We pass out my phone number, Dr. Ramirez's phone number. Sometimes we pass call on to Laura so that no member of ours who's part of Be Well will be left without someone to call who speaks both Spanish and English and can act and react very quickly. Unfortunately, Diane passed away. So I think the little question about how I even got into this work is as I said, I'm a PA, or as announced, a physician assistant, and I have a graduate degree in international health. And so I've been managing large scale. First, I practiced medicine for about a decade, and then I moved into doing international health. And I managed the health program for indigenous women in the Altiplano in Guatemala for 3 or 4 years, and then moved to Zambia, where I had the HIV/AIDS portfolio for USAID. This is before antiretrovirals. So most of the care I did was usually children and elders left behind because of the generation that died of AIDS was the generation between the child and the grandmother. It was devastating. It was devastated, the country. And the U.S. actually poured through our program $50 million in response, but money was not really just the only problem. So when I came to San Miguel, I at first thought, well, I'll just continue to consult in my field. I'll just consult from San Miguel. And one thing led to another, and I met Robin Lovett. And Robin and I brainstormed at least once or twice a week a business and a patient advocacy business. And I think you were even there when I came up with Be Well San Miguel. Or did you come up with Be Well San Miguel? Okay. And it was rolling right away. And our task was to play advocate, medical advocate. At that point, there were far fewer English-speaking doctors, and the ones that were many of the expats were very accustomed to the 3 English-speaking doctors. And I think they confused a person's capacity to speak very good English with good medicine. There was very little oversight of medical care here. I got some medical services I was not happy with. And then so I was beginning to refer people to Querétaro or elsewhere. And then Dr. Ramirez moved to San Miguel along with a group from Puerto Vallarta and opened, this is the first iteration of Unimed, the hospital Unimed. And Dr. Ramirez was the chief of medicine there at Unimed, and we began meeting. I don't know who contacted who, but it led to Be Well having an office there, and it worked. So I want the role of the patient advocate changes all the time here in San Miguel, just as the expatriates change all the time. So I wanted to just say that the preparation, having a plan for when things go wrong is so critically important, and that's what we're really focusing on in Be Well. That's part of how we work. Is a membership is a planning session. We look at all the legal documents, medical history, spend a great deal of time with our clients to get a plan of action, and we're available to them 24/7. So as people, we're beginning to see a lot more cognitively impaired people, some post-cancer, we're doing some hospice care. We're doing all kinds of different things. And the shift in medicine over these periods of time was really, really significant. with Dr. Ramirez, he brought with him a cadre of very, very highly trained physicians in all kinds of specialties and gave them a place to practice. So what we want to do in this talk is just to give you a brief overview of what you can do for an emergency plan and our recommendations. They're more detailed. They're more detailed in reality, but this is a once over so that we have some slides to cover with it. So let me the other way. No. So that's what I was just talking about. So what we advise people to do is to have a place either on the refrigerator, like maybe a big envelope with a pocket, or somewhere people will see where can find critical documents like banking documents, health documents, powers of attorney, etc. The most important thing is to have contact information locally and family in the States. These are the recommendations that we have, things that you should have available if you can at all in this package, this ready-to-go package. This will help the emergency response team as well as the physicians who see you. And Be Well works very hard to create this documentation on your behalf. And it's then shared with Dr. Ramirez, should you so choose to have him as your backup doc. So we have a set of English medical histories as well as Spanish, and they're both necessary because many people increasingly are going back and forth between the States and here. So you can see blood type, allergies, medication, essential conditions. This is a really important issue, keys. And that was part of the reason, perhaps, that Diane died such an untimely death. At this point, Be Well does not keep keys, but we keep track of where your keys are. And we ask each member to leave keys with at least 3 different people so that if for some reason there's an emergency and you can't open the door, which you usually can't, I cannot tell you how many people have fallen and laid for far too long with nobody paying attention. Nobody knows they're missing. And by the time someone knows they're missing, they're often dead. But that does not happen to members of Be Well. It shouldn't happen with members of Be Well. But this is another safety net that you can create for yourself totally without us, which is just a good friend and a neighbor if you live alone and make a pact to call each other every day. It would have avoided many, many pretty horrible situations and horrible deaths. I can't quite read this. This is the things that part of the things that we want you to think about is increasingly it's getting hard to be seen at a private hospital without having money up front. So we are people who have the means. We're asking them, we recommend that they leave, say, $10,000 in some sort of cash reserve that's readily available on a credit card or some other way, so that nothing is delayed because of lack of money. And there's always the consideration of insurance, but as many of you know, as we move further into past late 60s into 70s, it gets very expensive to have insurance. But if you do have it, we need to have all the information. It's really important for people to know the limitations of Medicare here in Mexico. And there's been quite a bit of confusion of late because Lakeside Medical Group has been saying that they can bill for non-emergencies and that they can bill outside the 3-month to 6-month window. In fact, that is not legally true. And it's all in a hubbub. There's a lot of stuff going on in the States about this and a lot of discussion here. But similar situations happened in Cancun, and those organizations and hospitals were shut down within a couple years. And the sad part is the person liable is usually the patient. And so when that happens, and if a patient has knowingly been getting care, knowing that it's outside their Medicare policy, despite whatever the local billing or billing agency says to them, you know better, and they can hold you liable. And I do have a client who was sued for $75,000. This was a few years ago. So basically, that's the limitation. Did I miss evacuation? Was that on that? Good, yeah. This is not asking you to be fluent in Spanish. This is a plea to be able to speak enough Spanish so that first responders know where you hurt, how long it happened, what happened, and there can be some kind of dialogue. It's quite it's very difficult to remain fluent in a second language when you're sick. So it's not saying you should be fluent enough to deal with an emergency in another language. This is a really important consideration, and it's a discussion I have with every member. It's a choice. No matter what happens to you, you need to be stabilized before you're evacuated. So people do need to realize that. But then the evacuations, this is partly because SkyMed has been here for so long, and Sarah Ash has been quite a wonderful advocate for the people in San Miguel. So she gets the very best care out of SkyMed, and so it's a good evacuation policy. I won't say much more about it. There's plenty of, you can ask questions later. Now I'd like to introduce one of my partners, Dr. Ramirez. And I want to talk a little bit about you before you begin your presentation. She's going to do the presentation here on how to assess the quality of care at a hospital. So Dr. Ramirez has been practicing medicine it is over 28 years. I think I got that right. And he's trained in emergency room medicine and critical care medicine. I don't know, you're one of probably 20 in the country with double certification. I don't know. And Dr. Ramirez, at one time or another, has been the chief of medicine at every hospital here. As he'll speak a little bit more about the dynamics around hospitals in this town. And things change on a dime, hospitals come and go. So he's going to talk a bit about that. But Dr. Ramirez has really allowed us to have a somewhat seamless relationship of we're the advocates, and then he is the physician providing care and makes the recommendations, but there's a lot of back and forth. And he never loses his cool. He's never been angry at me. I've never had cause to question any of his care. And I frankly have never heard a complaint of anyone who's seen him. He's got a great sense of humor. He's warm, and he's really one of the smartest docs I've worked with, and I've worked with a lot. So this next part, Dr. Ramirez is going to talk about, and it has to do with how to assess the quality of care in any one hospital. I think many people only think about their doctor, but they don't ask the next set of questions that can be even more critical, which is, where does that doctor practice? If you're going in for orthopedic surgery and the surgical equipment is ancient, you're not going to get a good outcome. Or if you have a heart attack and there aren't any of the fibrolytic agents available, nor an MRI, heart attack or stroke, you're not going to get care in a timely manner. And those kinds of details are not just details, they're really important. So Dr. Ramirez is going to take it from here, and then I'll come back.
Good morning, everybody. I know some people here as a patients and some others as a friends, and I'm happy to see you here and not in the emergency room. And it's very important what Deborah says about having a plan for emergencies. This emergency is nothing that we want to have, but once it happens, things can be difficult, especially to remember the protocol or whatever you have on mind. So it's better to have it written, as she said, and all the advices that she gave us is important. In my field, as an emergency uh, skills, I've seen a lot of problems, not either even with patients, but all surrounding situations. And sometimes it's very difficult to make decisions about if we need to proceed or not. But if we're talking of saving a life, as a physician, we do everything, and then we probably have to handle with the problems around. Anyway, since I arrived here about almost 10 years, my philosophy and way to work is to have the best care and doctors around. And it's been a real challenge because when we opened Unimed, there were not emergency doctors, I mean, with the specialty living in town, except for two of them. So I have to hire people from Celaya, Querétaro, Dolores Hidalgo, and try to have the staff 24/7 with this specialty. And that was the only hospital with these conditions. Then I moved to MAC, and they don't want this special program to have ER physicians 24/7. So that was a problem. But now with Hoya, we have the opportunity to work with, and we I start hiring again emergency doctors 24/7, and now is the only hospital with these uh, skills. Anyway, I'm sorry. Um, as you know, emergencies could be any time in your life. We don't have a special day for having an emergency, so that's why it's important to have these people around. Um, um, well, the facility has to have all the equipment and technology to treat the most urgent conditions, such as a stroke or a heart attack or all those kind of problems that could be deathly outcoming if we don't treat on time. Um, I'm trying to be fast because we don't have much time now, but um, in this field, as emergency, is not most of the times it's not the ER doctor the only one responsible for the good outcome of the people. Most of the situations we need to call another specialist, neurologists, cardiologists, surgeons, orthopedics, because the wide of different circumstances cannot be handled by just one doctor. So another challenge on me was to know people who has good credentials, who has good reputation, and hire them. And even they don't live here because most of them don't live here. can come for attend emergencies, and we have successful uh, results most of the time. Uh, this is most related to facilities. You can go and look for a tour in the hospitals here. We just have two, so it's not difficult, and you can make your choice. That's not a problem. Um, Another important thing is to have an alliance with ambulance companies because sometimes it's difficult to get by yourself to the hospital. So you have to have the backup of someone who can take you to the hospital. Um, anyway, those are our numbers. Um, some people knows I work night shifts in Celaya in a public hospital also, so sometimes I'm not available uh, on the on place at this moment, but I have a group of doctors that I can trust, and I can send you to them and have the first care. Um, I don't know. Okay, thank you very much.
Laura Miranda is a lawyer, and we met about a year ago. And I won't tell you the circumstances; they weren't very good ones, but we hit it off, and it became very obvious that a lot of the work I was doing, or should and wanted to do, was to ensure people were legally in good standing. They had their wills in place, and also that they had advanced medical directives. And the more Laura and I talked, the more and more we saw this is it's really both sets of information's really helpful and really necessary. So it is part of our intake as Be Well, as you also have an assessment of your legal status, papers, wills, that sort of things. Remarkably, many people do not give a thought to wills. Uh, some people have basic wills because they own property, but other than that, most expatriates don't seem to have wills that are legal here. So anyway, Laura's arrival onto our team has allowed us to really expand. She also has a social work background. So we have somebody who's very savvy with both the legal system and with the social services. And besides that, she's an incredibly nice woman and has been a real help to the team here in terms of improving the quality, broadening and improving the quality of care. We have a few recommendations. These are the things she's looking at. And you can see here, we also cover and always ask people about burial plans because far too many, someone dies and there's nothing's been planned and there's no money available. Money's maybe tied up in the States or not available. And in that case, if no arrangements have been made, usually the body is taken to Celaya and then cremated. Yeah, and then buried. So not a good outcome. And that's it. Actually, I didn't really mean to end on that note, but I guess it is the ending note. Thanks for your time.
Oh, don't go away. Don't go away. I got to give you one of our. Thank you, Deborah. I want to give you one of our fancy mugs here, and also someone grab a picture. You have one already?
No,
What do you? Oh, you don't have
no
one?
one ever gave
I think Doc's got like 6 of them. So if we ever want to get any, we're gonna grab them from him. Well, let me get a picture with you. And does anyone have any questions for Deborah? She's gonna be hanging out afterwards as
Or
well.
Emilio.
Okay, or Doc or Laura. Go ahead, Maureen.
You mentioned earlier that now you work on a membership basis.
That's correct.
Is it one plan fits all, or do you have different
No.
plans?
We have an annual plan
Uh-huh.
for one person, and
Okay.
we have a couples plan, which is annual, and it's quite a discount if you do it as a couple, and we have a quarterly plan.
Perfect. Thank you so much.
And all the information on pricing's on our website.
Hi, thank you for the presentation, by the way, very informative. I get my health care in the States through the Veterans Administration.
I have information for you.
Oh, good.
So we should talk after perhaps.
Okay.
But a new development is the Veterans Administration has passed policy and legislation that allows veterans to get care outside of the United States.
Perfect. Excellent.
And I've got the first one, the first
Okay,
person
I
trying
have
to
an
push
article
it.
saved at home that I haven't read in depth that addresses the
It's a
same
real
thing.
thing. I've been in contact with the VA, and he was able to pull in a legal team
Oh, wonderful.
to push the issue. And we're now really going. I think there's going to be a lot more veterans seeking out care, and the payment is they pay 100%, but there's a delay of about 4 months before payment, but it's guaranteed. Some of the veterans are living at such limited means. They're disabled and never got disability, insurance or et cetera, et cetera. So it's that may be somewhat of a problem because the tendency here in Mexico is pay up front. So I'm working on that.
Okay, thank
Okay.
you. I'll see you
Yeah.
after the presentation.
Yeah, please do.
Being another veteran, I just found out today that Lakeside Medical covers VA.
Oh, so they did make a contact with VA, so that you guys that has nothing to do then with Medicare. So there's no problem there with Lakeside. It's completely, that's really good news.
Any other questions?
And you're going to be hanging out, so.
Yeah.
she'll have some
Yeah, I'll
information.
be here. We're going to be hanging out.
Great. Thank you.
I have flyers for the Be Well business. We'll maybe leave them there.
Okay.
People might be interested.
All right, excellent. Fantastic. Thank you very much. Thank you, Deborah. Thank you for bringing in your team today. Great to see you both. I think we're going to call this meeting a couple minutes early, so let's start our day. Thank you very much, everybody. I'm going to be back again next week. All right. I'll see you then. Thank you. Have a great day.